Okay, guys, so we're going to go over the muscles now. We're going to go over upper, and then we're going to go over lower extremity. We're just going to hit all the important muscles of upper and lower extremity. These are all skeletal muscles, of course. So let me give you guys these. I'm going to give you the numbers too, and that way you can put those on your handout. Just help you find them again. Let's start with the first one. We're going to go over the deltoid so I can move it out of the way. This might be in a slightly different order than your list. You guys can help me make sure I don't forget anything, but the deltoid is going to be this muscle of the upper extremity. It's number 12, right? Notice it covers the lateral aspect of the shoulder. So what we're going to do is we're going to move the deltoid out of the way so we can see the rotator cuff muscles. Okay, so there goes our deltoid. Going to get that out of the way. So now what we can do is we can look at the rotator cuff. This is the posterior side, right, of our scapula. If I flip it over, here's the anterior side of the scapula. Okay, that's where we're going to find our rotator cuff muscles. Remember we said the rotator cuff muscles hold the humeral head into the glenoid cavity. Right, so they're really for stabilizing the shoulder joint. So let's look at our muscles real fast. This is our superior muscle. So this is the supraspinatus, number 6. Okay. Number 6 is supraspinatus. Number 7, infraspinatus. Notice it's below the spine, so this would be our infraspinous fossa, correct? Where's supraspinatus? Supraspinous fossa, correct? So infraspinatus would be 7, supraspinatus number 6. We go a little bit lower, we see teres minor, also a rotator cuff muscle, right? That would be number 8. Okay. So these obviously are more on the posterior side. You could say supraspinatus is superior, but these are clearly on the posterior side, right, of the scapula. Notice this muscle is number 9. This one's below teres minor. Anybody remember what muscle that was? It's not a rotator cuff muscle, but it's below teres minor. Yeah, that's teres major. It's actually quite a bit bigger. It doesn't look like it here, but that's teres major. It's not a rotator cuff muscle, but it's located below teres minor, and it is quite a bit larger, okay? So our missing rotator cuff muscle that we haven't seen yet is this one, which is subscapularis. That number has a sticker on it. It would be number 5, right? This is in our subscapular fossa, okay? So again, it's holding the humeral head. You can picture it pulling the humeral head into the glenoid cavity. Okay, so that is subscapularis. So then we'll just go ahead and move down a little bit. Look at the bicep. So here's our short head and our long head. So the bicep brachii, 2 heads, right? This head is going to be number 13. This is the short head. How do I know that's a short head? What does the short head originate on? Anybody know? What was the origin for the short head? You remember? It's our coracoid process. Long head goes to the top of the glenoid cavity, so that is going to be number 12. Right? So you can't just go by what it looks like lengthwise. You've got to actually go by the attachments. Short head is going to attach to the coracoid process. Long head is going into the joint. Okay? So this would be our biceps brachii. Number 14 is brachialis. Okay? 15 was this weird little coracobrachialis, which flexes the shoulder. It's just a little tiny muscle. Okay? If you go back here, we've got 17, 18, and that's kind of a blur, but that would be, let's see, tricep, so that is definitely 16. So 16, 17, and 18 would be 3 heads, that would be tricep. Right, this is your tricep. That's blurry, but it's number 16. So 16, 17, 18 is a tricep. Okay? And then we also have a muscle here, moving this around quite a bit. This muscle right here, think about it. It goes across the elbow. It flexes the elbow with the thumb up. So what muscle is that? Anybody remember? It's going to be number 19. Remember what muscle that was?
The brachioradial?
Yeah, brachioradialis. So it still flexes the elbow. It's an elbow flexor, but it flexes it in the thumb up position. So that's brachioradialis number 19. Okay. Then we have, we're going to move down into the forearm a little bit. What did we say the muscles of the anterior forearm do? As a whole, we said there, right, the anterior muscles of the forearm are, yeah, they move the wrist and the fingers. How so? They're wrist and finger what? Wrist and finger flexors, right? Am I right? So this muscle right here, it's on our ulnar side, so this would be flexor carpi ulnaris. Flexor carpi ulnaris. If you want to know that the number is going to be 25, it's covered up, but it's flexor carpi ulnaris. Number 23 is going to be flexor carpi radialis, right? It's on our radial side, thumb side. So flexor carpi radialis. The muscle right in the middle, believe it or not everybody has this muscle, but number 24 is palmaris longus. Okay, palmaris longus. And then the muscle on, it's really deep to palmaris longus. It's number 26 is flexor digitorum superficialis. Okay, flexor digitorum superficialis is right here, right? That tells you what it does. Flexes the digits, right? Flexor digitorum superficialis. It's a superficial muscle, flexes the digits. Okay, so that's our upper extremity. I think we covered them all there. You know, you don't need a lot of time to nail those down, but it is something that you guys have to study. So then we flip to the lower extremity. Okay, we hit these muscles that are a lot bigger. We'll try to go in order here. We'll start with a really easy one, gluteus maximus, right, which is number 11. What did we say gluteus maximus action is?
It's like when you're stepping up. It's the,
Yeah, pushes the body up. So what is the action of the hip? It's hip. What do we say? If these are flexors, what's gluteus maximus going to be on the opposite side? Yeah, hip extensor. Okay, so that's number 11, gluteus maximus. Okay. This is going to be the outer part of the leg, right? Lateral aspect. So this right here is a tendinous band. It's number 19, called the iliotibial band or iliotibial tract. It's number 19. 18 right here is the muscle that attaches to it, tensor fascia lata or tensor fascia latae. That is the little muscle that attaches to this band. What does this band do? It stabilizes the pelvis. Believe it or not, it's a stabilizer muscle. Okay? So then we move down a little bit to the quad muscles. So most people know these are quads, but we want to talk about the four parts, right? This muscle, number 20, is rectus femoris. Rectus femoris is right on top. It's right in the center of the thigh. Okay, so that's rectus femoris. This one actually is a hip flexor as well. What does the quad do, though, as a whole? What's its action? I'll give you a hint. It's on the knee. Yeah, knee extension. That's good. So, well, let me say this. What's under rectus femoris? I'm not going to pull this out, but if I looked under here, well, there we go. Number 22 is vastus intermedius. That's number 22, vastus intermedius. Okay. Number 21, look again, this is the lateral side, so this is vastus lateralis. Number 23, this is the medial side, so this would be vastus medialis. All right, so the names make sense. Okay. Then where did we say our adductor muscles are located? We obviously know what they do, right? They do adduction. Where are they going to be located on the leg?
inside.
Yeah, inner thigh. So these are all adductors, correct? So let's talk about these adductors a little bit. So we have adductor longus, which is going to be right here. Adductor longus is going to be number 26. Adductor longus. 28 is adductor magnus. So longus is 26. Adductor magnus, 28. Gracilis, kind of out of order here, but gracilis is number 27. Okay, so there's gracilis, number 27. There are some other adductors. We're not going to go over them. We also have sartorius here. I'm going to show you sartorius real fast. That's number 24. What do we say about sartorius that was unique? Longest muscle in the body, the Taylor's muscle. Okay. And let's flip now. The one muscles we haven't done yet is the hamstrings. So here's our hamstrings. Right? So we've got hamstring on the lateral side is always going to be biceps femoris. So again, this is our lateral side. Biceps femoris is going to be numbers 31 and 32, right? Because there's two heads. On the medial side, we got semimembranosus, which is 29, semitendinosus, which is 30. Yep, 30. So semimembranosus 29, semitendinosus 30. Okay? So those are our hamstrings. And then the last part, which really is the easiest, we got tibialis anterior, right here. Tells you exactly where it's at, right, on the anterior tibia. What did we say it did yesterday? What's its action? Close. What's the name, the exact name? Dorsiflexus. Yeah. So this is, what number is that? 33. It's covered up. Gastrocnemius. What's that going to do? What's its action? What are the terms for the ankle and foot? Well, if this one dorsiflexes, what's the opposite one do? Plantar flexes, right? Pretty straightforward. There's the two heads. It's 37 and 38 for the two heads. And then under it, we said this before, deep to the gastrocnemius is soleus, 39. Right? Again, I'm not going to pull it out, but if I looked under gastrocnemius, we got soleus, right? Remember, both of them attached to our Achilles tendon. Okay? So that's all the muscles of upper and lower extremity.